My name is Doris Kwenda. I'm a speech and language therapist. So we specialize in speech, voice, and swallowing disorders. A speech and language therapist works on 4 areas. We do receptive language, which is what goes in, expressive language, what comes out, reading and writing. Then we also work with people who have swallowing disorders, which we call dysphagia. A variety of conditions, and typically I work with children and adults. In children, we work with children who have delayed speech. Delayed means when they are 2 and a half, they don't have enough words. So they should typically have at least 50 different words. So when we see children at 4 and they are not yet speaking, that's delayed speech. And delayed speech could be as a result of other issues. We have cerebral palsy, there is autism, there is hearing impairment. Some are just unknown, the causes are unknown. Those are typically the groups I work with, or including stammering. In adults, I work with the ones who have lost their speech due to stroke, traumatic brain injury, or a brain tumor. Then we also work with people with head and neck cancer. You should start getting concerned if at 2 and a half your child has no words at all. Then we push it. What I typically advise is, first of all, we have to have a hearing assessment to rule out any hearing issues. If the child can hear well, then we try and figure out what could cause the delay in speech. So you should be worried at 2 and a half if your child has no words at all. In adults, causes would be surgical procedures, medical conditions like, let's say, after a stroke. Surgical procedures would be like in the head-neck injury, where they have to have their voice box removed. In adults, that's what would cause the swallowing problems. In children, we would have typically cerebral palsy. That's what causes a lot of swallowing problems. But in children, we also have feeding problems, whereby it's they just don't feed well, and it could be other different conditions. For example, children with autism have trouble feeding just because maybe they don't like the texture of the food, and when they don't feed well, then it brings other nutritional concerns. In adults, especially those who are hospitalized, if they eat anything and they cough, then that shows there's a problem with the swallowing. There are those who may not be strong enough to cough it out, so they'll tear. We look out for that. Or sometimes when they speak, after swallowing, and when they speak, they have a gurgly sound. So those are some of the signs to look out for. In children, children will typically either pocket their food, or they'll have they spit it out. So those are some of the signs to look out for. And in even younger children, like the babies, they would have whole food in their stool. So that is something also that will tell us there's a problem with the feeding and swallowing.